This is Samantha Frontera, and I'm super excited to have another doctor series this week. And today we're actually going to be talking about brain health, and we have nobody better than to do it, a local Chicagoan doctor, Dr. Lenny Cohen. And I'm really excited that he's here with us today. He also runs the Chicago Neurological Services, and I'm just very pumped that he's here with us today. And I can't wait to talk about brain health. And just kind of learn a little bit more. So thanks so much for coming on the show.
Hey, Samantha. Thank you for having me.
Yeah, absolutely. So I just wanted to learn a little bit more. I know that you have a book coming out at the end of the month, but I want to kind of just start from the beginning history as to tell us more about why you became a doctor, and specifically somebody who helps with our memory, our brain health, and all of that good stuff.
Well, that can be a rather long story, but to make it short, I was in a family of four, and I was the youngest one, and I believe that I was probably one of the child who was always getting something, either broken bone or some sort of sickness, and was always getting some sort of attention. Thankfully, in my family, there were plenty of physicians, altogether probably about 7 or so. So each of them had a chance to treat me to the best of their abilities, and successfully, I would say. And at the age of 12 or 13, I fell and I sustained rather serious trauma to my spine that required a number of visits to physical therapy, to neurosurgeons, etc. And that pretty much led me to truly believe that that's what I want to do, that I want to be a physician, and more specifically, that I want to be a neurologist. I was always having rather inquisitive mind when I wanted to find out things about how everything is working, or why are we doing this versus doing that. And I thought that neurology would be the very right setting for me to do this. And I was right. Neurology is one of the fields that is actually studying how your brain is working, how does it affect your maybe emotional status, your cognitive status, your motor function, etc. And in the last 15 years of practicing in Chicago, I was able to help hundreds of, maybe actually thousands of patients with dysfunctions of the brain as well as peripheral nervous system.
I think that's amazing. And I definitely feel like brain health is so important. I specifically have 2 people in my family in which it's been impacted in terms of your brain health. And I know that you work with a lot of people who have Alzheimer's and dementia. Someone in my family has aphasia. I'm sure that you deal with people like that too. Can you kind of walk us through in terms of when somebody is diagnosed with some type of a condition and what that looks like?
Absolutely. So just like you are affected by someone in your family, unfortunately, I was affected as well, with my father developing dementia in his young 70s. And actually, we recently had 5-year anniversary of him passing. That shifted a lot of what I do toward to more of the brain wellness and treatment of the specifically brain conditions, as well as educating patients and friends about how fragile our brain is. For some reason, we're really concerned about how good do we look, or how good our blood pressure is, or our blood glucose is, but nobody really thinks about how well our brain is working. The only time when we get concerned about this is when your brain is no longer able to perform any sort of function. And in many cases, it's a little bit too late at that time to do anything, because any sort of dysfunction or any sort of insult to the brain already happened, and can happen due to many different things, anything from metabolic abnormalities with insufficiency of some simple vitamins that you did not take, to having multiple strokes, or having injury to the brain, or actually having multiple injuries to the brain, as we see in patients in professional football field who develop so-called CTE, or chronic traumatic encephalopathy. So there are different types of dementia, and aphasia that you mentioned is inability to speak that can be seen in patients with stroke, as well as some other neurodegenerative conditions, as well as dementia. My job as a neurologist is to identify underlying cause and hopefully able to lead patient to their journey, how we can help them, which by itself is a very lengthy conversation, but I'll be more than happy to discuss it.
No, I think that's amazing. And I know that you kind of talked a little bit about in terms of the fact that we can do something even when we're younger in terms of our brain health at our 40s or 50s. What things should we be doing in our everyday life to kind of keep our memory strong and to keep our brain healthy and active? Is there anything we can do early on?
Yeah, absolutely. So like once again, as you pointed out, a lot of the pathological changes, meaning abnormal processes in a brain, do not start at the time when you have clinical symptoms. They actually start years and years prior to that, in many cases in your late 40s, young 50s. And at that time, you're still able to process information. You're still able to do what you normally do because your brain is able to compensate for things. There's even a term that we have, something called cognitive reserve capacity, meaning how much your brain can tolerate before you're going to have a point of no return and it's unable to function as you want it to function. So yes, I do think that everybody in their 40s and 50s need to do something to preserve their brain and to do something about their brain health. A few things are relatively simple things. We do know that patients with cardiovascular risk factors are predisposed to have dementia, most likely due to hyperperfusion of their brain. And some studies indicate that it can lead to accumulation of amyloid protein that is also one of the abnormalities that we see in patients with Alzheimer dementia. So obviously working for patients who do have such factors and eliminating such factors is a very big thing to do. Patients with diabetes are about 50% more prevalent to have dementia versus healthy patients. So adjusting what you eat, how you eat is a very big factor. There's very interesting theory about why do we age? Why our brain is not functioning as it's supposed to at the age of 90 versus at the age of 20. And there are a lot of different factors that can contribute to that. I mentioned some of them. But one of those factors, the theory is rather interesting, is oxidative stress. Pretty much everything what you do in a daily activities is associated with oxygen consumption. But food that you eat can increase your oxidative stress. For example, meat products are known to do that. Environmental factors can do that. So aging of the brain is not a simple thing by itself. It's definitely involved many different things of what do we eat, where do we live, do we exercise or not. A few things that I always tell my patients: eating healthy is a step number one. Exercises is step number two. Actually, Alzheimer Association is recommending to have 5 hours of physical exercise per week, which can actually delay onset of dementia. And it's like 5 hours is probably what most of the people should be exercising. And it can be something relatively simple, from walking around the block to actually exercising in a gym. And one other thing that I also tell my patients: when was the last time when you actually use your brain actively? Like when you were back in high school, you had to remember or memorize a lot of different things that you had to present. So you had to memorize a poem. We no longer doing that as we're growing older. It's like we kind of utilizing our brain for everyday activities. We fall into predicament of what do we do, and we no longer expanding the usage of our brain, which can do quite a lot. So one of the things that I always recommend for patients in their 40s and 50s, learn a new language. That is relatively complex task, but it's, number one, can be helpful. Number two, is truly beneficial for how your brain is working. And another one, learn a musical instrument. Playing a musical instrument requires every domain of your brain to be involved, from reading notes, listening to music, playing on an instrument with muscle memory. Every part of your brain is involved, and all of that together will benefit your delaying your aging.
Absolutely. Those are some really great points. And I know that Alzheimer's is actually the 6th leading cause of death in the US. So can you tell me a bit more about it? Is it genetic? And, can you share more with just a regular person who knows nothing about that, but knows that it's in their family history? Like, for example, if your grandparents had it, does that mean that you're for sure going to get it? Or how does that work?
Okay. So yes, it is genetic to some degree. The very first patient who was brought to Dr. Alzheimer clinic over 100 years ago, and her picture is pretty much in every textbook, was brought by her husband. It was a woman at relatively young age of young 50s. And at that time, she already had very advanced dementia, where she was not able to do anything or did not have something what we call activities of daily living. And she was relatively young. And we do understand that that particular patient, the patient number one who was diagnosed with Alzheimer's dementia, did have genetic predisposition to that. In the most commonly known genetic mutation is ApoE mutation, and it increasing the risk of dementia, specifically Alzheimer's dementia. It doesn't mean that you will have it, but it does increase the risk. So we have 4 alleles or 4 genes for that particular ApoE mutation. If you have 4 of them mutated, that probably indicates a higher risk than somebody who has no mutation whatsoever. It is available through 23andMe. I'm not a spokesperson for that company, but they can run this genetic testing. And a lot of us do have at least one allele affected, which is increasing the risk. But my point is that having a risk does not mean that you must have that disease.
Absolutely. And I know that we're always like constantly seeing like these top headlines that say like, you know, that scientists are working on a cure for dementia or Alzheimer's. How true is that? And I mean, within your history of being a doctor, how close are we to finding a cure for that? Or what type of medications might be available that you help your patients with?
So, yes, you are absolutely right. Scientists are working, and as of right now, we have over 5 million people with Alzheimer's dementia alone. In the next 15 years, that number going to triple. Besides Alzheimer's dementia, that is well recognized, that other types of dementia that exist, including Lewy body dementia, frontotemporal dementia, and some other types of dementia that can affect. One of the reasons why we have such increased number of dementias is that patients are living longer. And in the past, unfortunately, we had cardiovascular problems that were killing people in their 50s and 60s, and those patients simply did not have a chance to develop dementia. Now we successfully able to intervene with those cardiovascular problems and able to help with those, but we do not know how to proceed with step number 2. As in the very beginning of our conversation, I pointed out, by the time when diagnosis is made, the treatment is pretty much most of the time is to treat your symptoms only. Medications that we currently have for Alzheimer's dementia specifically meant to slow down disease, and that's it. In the last 15 plus years, we did not have any new pharmacological advances for patients with any type of dementia whatsoever. FDA recently approved a new imaging study that is able to tag to tau protein, which is one of the pathological proteins that's seen in Alzheimer's dementia as well as some other types of dementia. And by doing that imaging, it can help to make diagnosis. But we do not have any sort of treatment for dementia, which brings us back to the very same statement a few minutes ago that I made, that we need to intervene early in our disease. The comparison that I always make for our patients is, think about Alzheimer's dementia is having termites at your home. Let's have you got termites, they did something damage to your home, and finally you got a general contractor who came and said, oh my God, you got termites, but we can get rid of them. Mm-hmm. Well, with a house, it's relatively simple. You can pretty much wipe out all termites, and you can change some of the structural abnormalities that you might have in your house. With a brain, we cannot change anything. If a damage is done with accumulation of the toxic protein like amyloid and tau protein, you cannot reverse it. There were a number of studies that were done. If we will reverse that amyloid protein, can we improve somebody's outcome? And the answer is usually no. Like, once again, if you want to start treatment for something like this, you need to do it preemptively in your young years.
Yeah, that definitely makes sense. And I know that also at your practice, you use IV vitamin therapy. Can you share a little bit more about that and how that seemed to have helped some of your patients and why you feel like it might be important?
So we do more than just IV vitamin therapy. I'm a practicing neurologist. I utilize anything from conventional Western medicine to something that is maybe not FDA approved yet, but in a research process. And I think that it's my obligation to offer my patients to do something that can potentially help them. A couple of modalities that we do, one of them is IV vitamin therapy. The most specifically what we use is NAD+. It's a mouthful. It stands for nicotinamide adenine dinucleotide, which is a chemical that we all have in our body. By age of 40 to 50, that number pretty much reduced by 50%. and it's been linked to some of the neurodegenerative conditions. And some animal studies indicate that supplementation of NAD+ can help with brain aging. So that's what we offer to our patients in the form of IV supplementation. So it can penetrate through blood-brain barrier and affect how brain is working. Other few things that we do, alpha-lipoic acid is another supplement that we have at our disposal, but we also have in our body. It's known to be strong anti-inflammatory agent. And one of the theory of aging is that we have this chronic inflammation happening in our brain due to some sort of oxidative stress or due to something else. Since alpha-lipoic acid can penetrate through blood-brain barrier, it can reduce that particular inflammatory processes and hopefully reduce the risk of developing dementia. All of that is considered to be investigational, but at this point, since we do not have anything that is developed or confirmed for our patient, I think that we can take some of the data from investigational studies and try to offer it to our patient. One other thing that we do is relatively interesting is hyperbaric medicine, which is treatment with oxygen under pressure. Hyperbaric medicine is not a new medicine. It's been done for more than 100 years. It got somewhat more popular in 60s and 70s, but then with advances in pharmaceutical industry, it slowly died out. And in the last 20 years, it probably started to resurface again. And there were a few studies that showed that hyperbaric therapy can be helpful in patients with vascular dementia. Once again, those who do not have sufficient blood perfusion due to a number of different reasons. And as I truly believe that most of the patients that we have with Alzheimer's dementia do have elements of vascular dementia. What it means that their blood vessels are no longer working as they're supposed to. The brain is no longer getting sufficient amount of oxygen and developing this hypoxic state and therefore leading to ultimate dementia. So we offer the relatively comprehensive approach to anyone who have memory problems to figure out how we can help them. And I always tell my patients, when you come to any physician, we have something to offer. Ultimately, it's going to be a patient choice to decide what's the best that fits their lifestyle and their ultimate goal. My job is to guide them in this journey.
Absolutely. And I know that you have a new book coming out and we're wrapping up the interview. So if you can tell us a little bit more about that and where we can find more information to come and see you if we do have any brain issues or any memory loss or brain fog, where can we find you, and tell us more about the book?
Absolutely. So the book is going to be published on our website. It's going to be free of charge. It's just Introduction to Brain Wellness. Hopefully it will be available within the next couple of weeks. This is just something for my friends and family were asking me to do for a relatively long time, just put on paper what I'm talking about. So our patients and friends going to be educated about what the brain wellness is, what we can do, what we can, how we can help with any sort of abnormalities. It will be available on both of our websites. One of them is www.chicagoneurodoc.com, and another one is www.therevivedoc.com. It will be available free of charge. Like, once again, this is a purely educational material for somebody to learn what we are doing and how it can potentially help them.
Awesome. Well, thank you so much for being on the show today. We really appreciate it, and we look forward to talking to you again soon.
Thank you very much for having me.
Thank you.
Bye.